for as the gospel worship recorded song of the year. Just should be yesterday or something. Yeah, amazing. Good to have you on Hope FM. This is where you listen and live. 93.3 in Nairobi and its environs. 101.9 down Athi Coast. This is Praise Junction. My name is Sharon Aitore Wangenye, and it's such joy to have you join us for today's conversation as we have a conversation about breast cancer and also talk about other breast conditions that there are. And we have the privilege and honor of having Dr. Mukami Gathariki. She is a plastic, reconstructive, and aesthetic surgeon. I got it right. No, I did. Mukami. Yes, I did.
Thank you.
Awesome. Thank you, Mukami, for coming.
Thank you for having me.
And we have so many questions.
Yes.
That we love answers, and I know you're going to answer them for us. But before I indulge you, I would love to remind my listener that they can write to us. 20933 is our text line. 0717400555 is our WhatsApp number, and at Hope FM Live across social media. Okay, back to you, Daktari. Please introduce yourself, just in case I got anything wrong. Nambam Sama.
No, you did very well.
I did.
My name is Dr. Mukami Gathariki, which you got very well.
Awesome.
I am a plastic, reconstructive, and aesthetic surgeon.
Okay.
Here in Nairobi, Kenya.
All right.
Yes.
Great. It's nice to have you.
Thank you for having me.
It's October. It's breast cancer awareness month.
Yes.
And we want to be aware, to be made aware. What is breast cancer? What causes it? The signs and symptoms and all that.
Yes.
So let's start with, what is this thing? What is breast cancer?
Breast cancer is when you have abnormal growth of cells in the breast. It is one of the leading causes of death in women. It does affect both women and men, but mostly in women worldwide and in Kenya. That's why you can see there's a lot of, I don't want to say halabaloo because it is a leading cause of death. Okay. So for someone who has not been affected, they may wonder, why is there so much noise about breast cancer? Sure. But for someone who has been affected one way or the other, either personally or by a mother, a sister, a friend, then they do understand why we make so much noise as healthcare workers during this month. Right. So it's an abnormal growth of cells that occurs in the breast.
Okay.
Yes.
So how does one get to know that they have breast cancer? Or what are some of the things that, they would experience and they say, maybe this. I'm talking about signs and symptoms. What to look out for.
Yeah. The problem with breast cancer is that it occurs in a gland, because the breast is a gland that is a bit dense. Meaning that by the time you get the symptom, it's a little bit advanced. So that is why we advocate for monthly breast exam, and I think we'll come to that. So one of the symptoms is what you will elicit, what you will see, and a sign is what the doctor will elicit or they will see. So for symptom, what you may see is, number one, you will feel a lump or something hard, because remember, breast tissue is soft.
Yes.
Yeah. So when you're doing your monthly breast exam, which we advocate for, you'll feel something hard, something different. Number two, you may see some skin changes. Remember, the skin is soft, it's supple. So when you have breast cancer, by the time it's manifesting to the skin, well, we've gone further along than maybe we would have wanted. So it's something we call peau d'orange, meaning it looks like an orange. Remember, an orange has pores that are bigger than maybe what your skin would have. So that's what your skin will look like, an orange. If it's a little bit advanced, of course, your skin will necrose. It will have maybe a black color. It will start to bleed, because remember, cancer eats up the normal cells and produces abnormal cells. And then you may have nipple discharge, which is serosanguinous. That means it's bloody. And remember, if you're not lactating, that is, if you're not breastfeeding, ideally you should not have any nipple discharge. So with breast cancer, you will have some nipple discharge. Then, of course, you'll have some pain because it is cancer. It is abnormal. It is eating your normal cells. So you'll have some some pain. Then when you have cancer normally in your cells, apart from attacking your cells, it attacks your lymphatic nodes. So, and one of the nodes that it goes to are the ones located in your armpits. So you'll feel some nodes, something swollen in your armpits. So that is also another symptom you may be able to elicit.
Okay.
Yes.
All right. Dr. I love that you say that we don't want to get there. Where we are, seeing all these symptoms, you call them. So what should we then do so that we're able to get this early enough?
Number one, we want to do the monthly breast exam. Okay. We don't want to wait for October to always remind our loved ones that we should always do the monthly breast exam. So once you or your girl child goes into the teenage years and they have fully developed breasts, we want to encourage them to start the monthly breast exam in the shower. It's actually quite easy. In the shower, while you're having your shower once a month, you can have a particular date in mind, maybe on the 20th. Every 20th, I'll be performing a self-breast exam. Quick 2-minute thing, and you're good to go. It would actually be life-saving. I know as a woman, putting aside the doctor aspect, it's quite scary to think that you could ever find a lump in your breast. So sometimes we prefer to come from a ignorant point of view, but it could actually save your life. So those monthly breast self-exams in the shower could actually save your life.
Okay. Could I ask, how does it look like? How does the exam look like? Like, do you have a few steps that we can follow?
Yes.
Okay.
So what we do is you stand upright while you're unclothed. You lift your hand and put it behind your head. So that you have your breast fully exposed.
That is one by one.
One by one.
Okay.
Yes. Then you take this other hand. For example, the left hand is behind your head. Then you take your right hand and start from the outer side of the breast. While you're gently massaging the breast outward, then you come to the top of the breast, then medial side, then lower side, then behind the nipple.
Okay.
That should be enough. And then you squeeze your nipple just to check if there's any discharge. Can you imagine that is enough?
Oh,
just that.
It's as simple as...
It is as simple as that.
Okay.
Okay. If there's any lump, you should be able to feel it.
All right. And for the avoidance of doubt, Dr. Does a lump then mean cancer?
No.
Okay.
It doesn't. Actually, 3/4 of the time, a lump does not equal cancer.
Okay.
There are benign lumps, which are very common, especially in a non-menopausal woman. And we call these fibroadenomas. And especially they become prominent during the when a woman is experiencing their period. They become bigger because of the hormonal influence. So even when you feel this lump, I would encourage you to visit your doctor so that we just biopsy. We take a biopsy of the mass. We just confirm it's a fibroadenoma. If we do, if it's not too big, we will just monitor it as the doctor and as yourself. If we feel it is becoming bigger, we might excise it so that we don't, to avoid any future problems. If it's not too big and if you feel you're comfortable as a woman, we just continue monitoring it. So 3/4 of the lumps actually are non-cancerous.
Okay.
So there's no need to worry.
All right.
Yes.
But then you're saying that once one notices a lump, they should see a doctor so that to rule out.
Yes.
Is the biopsy what rules out the cancer?
Now there
are several other things.
Yes.
Okay.
There are 3 things that will rule out the cancer.
Okay.
Number 1, it's a physical exam, and by the physical exam I mean also taking a history. because a cancerous lump grows very fast. And so I'll be able to elicit that by taking a history. You'll tell me, hey, doc, this lump from maybe January to March has grown very fast and it's very painful and the skin has changed.
Okay.
That I will elicit from taking a history from you. Number two, by physical examination. A cancerous lump attaches to skin and other structures around the breast. An uncancerous lump doesn't. And then by taking a biopsy and by performing various imaging modalities. So there are very different ways of confirming whether a lump is cancerous or not.
Okay.
Yes.
All right. So you answered a question we had wanted to ask earlier, whether it does also affect men, and you said yes, it does,
Yes.
but is mainly found in women. But then one would ask, is there a certain group of people that are more predisposed to getting cancer? Who is at risk? Let me just put it so. Who is at risk of getting breast cancer?
Number one, being a woman automatically predisposes you to getting breast cancer than a man. Quite unfortunate, but it's because of the hormones, estrogen and progesterone. Number two, a family history. So if you have a mother, a sister, a grandmother, a cousin who had breast cancer, then that should automatically trigger your mind to that. As this means probably you do have some particular genes such as BRCA1 and 2. And the women who have been tested and have been found to have these genes opt to have prophylactic mastectomy.
What's that?
If you have been found to have this gene, you go to a doctor and you have your breasts, quote unquote, removed.
Okay.
Because you're almost certain you're going to develop breast cancer and you do not want to go through this trauma of getting surgery, chemo and radio. So you just have the breasts surgically removed before any of that happens. Then of course, remember, cancer, especially breast cancer, is a play between genetics and environmental factors. There's no way I can pinpoint a certain thing and say this is it. So we are talking about obesity, we are talking about lifestyle, things such as smoking, taking alcohol, lack of exercise, exposure to some environmental toxins. So much is at interplay that I cannot actually pinpoint at one thing. But what I've mentioned basically is what can predispose one to getting breast cancer.
All right.
Yeah.
It's interesting to hear that things like, lifestyle, exercise.
Yes.
We take that like, I'm just fine with my weight. So much but it could expose us to other things.
Yes,
it's
it
interesting
does.
to note.
Yeah.
Okay. So how do we... I don't know if I should ask this question after you answered that one, because I want to ask.
No, please ask. Please. That's why I'm here.
How do we stay away from it? How do we sort of minimize the risks of getting this cancer?
I like the word that you've used, minimize.
Minimize.
Because sometimes we can only do our best, and I think we leave the rest to God, to be honest.
Sure.
So number one, lifestyle modification. Let me tell you, when people insist on exercising, they're not really trying. It's not a fad. Like, it's not, it's in today, it's out today. Yeah. So, exercising, it doesn't have to be going to the gym, because I know that comes with a lot of economic, situations.
Right.
So you can just take a walk in the morning, going to work. Instead of taking the lift, take the stairs. That can help. Then, of course, diet. Go back to your traditional foods, ndoma, ngwashe, arrowroots, stay away from wheat products. That has a lot of implications. Then, of course, we are talking about If you can avoid certain environmental factors, radiation has been shown to affect, to lead to causation of cancer. That could help. So basically, what you're able to control, please control.
Sure.
Just try your best, and of course your monthly examination. If you feel a lump, please see your doctor. Don't wait till last minute, because sometimes we see some situations where the patient has waited till we cannot do anything as doctors, and you feel so defeated, you can't help them. So when you feel something, please do not be afraid. I know there's so much fear to seeking medical attention when you feel something wrong in your body, because you fear the worst. But sometimes that lump does not mean it's the worst. Just come to us. Let us walk you through that journey.
Sure.
Yes.
And now that you say that, Daktari, cancer, any cancer, and in this case, now that we're talking about breast cancer, please emphasize again, it doesn't mean death. Yeah? Stretch it further. Or does it?
No.
There are interventions that you've had, and people actually got
Yes.
well.
We've been able to intervene early enough. And that's why we are... Actually, nowadays, we are moving to preventative medicine or preventive medicine.
Okay.
That's where you'll find most of us coming to radios, on social media, making so much noise. You might think we are just making noise for a reason, or for no reason, rather.
Sure.
But we're really trying to move to preventative medicine, because we do not want to... Not that we don't want to treat patients, but we want to prevent. Yeah? So please... If you feel something is wrong in your body, do not be afraid. Come to us. We will help you early enough. Don't wait till last minute when you have a big mass that is smelly, that is oozy, because some things you see, the patient has waited for like 3 years, 5 years, and they only come to you because the mass is smelling. That's the only reason they come. When you ask them, why didn't you come earlier? They're like, I didn't see the need. And they have a big, huge mass swelling. But they only came to you because it is smelling. And the neighbor or the friend or the spouse is like, I can't do this anymore. You have to go to the hospital. So we're trying to create awareness that don't wait for that long. Come, let's help you before it gets to that situation where nothing can be done.
Okay.
So people need to be aware that there is medical help. We can help you. Don't wait till the last minute. Yeah.
Okay. And I, at least I've heard or read
yes.
of situations where you had to should I say remove the affected breast?
Yes.
And also heard of stories where for some people it comes with a lot of stigma, you know. What would you want to say around that area?
Thank you for bringing that up. Breast cancer management is really psychologically draining, because the patient has to undergo quote-unquote surgery, so be it a lumpectomy or a mastectomy, depending on the stage.
And the difference is?
If it's the earlier stages, we can do a lumpectomy. We remove the mass itself and maybe some tissue around the mass.
Okay.
And that can be disfiguring, meaning the breast will not be its usual shape. Then if the cancer has progressed, the whole breast is removed so that we don't remain with any cancer.
Okay. And that's what's called mastectomy.
Yes, that's mastectomy. So you can imagine, for a female, the breast gives you identity. It's a part of you. So having that removed, going through chemo, which you lose your hair, you're physically drained, you're emotionally drained. After that, you go for radiotherapy. It's financially draining. That's why you'll see people having fundraisings. So breast cancer management in itself is really an issue. So also as a plastic surgeon, we are trying to create awareness so that when you're managing breast cancer, you introduce the reconstruction aspect.
Okay.
You tell the patient, yes, we can also reconstruct your breast so that you can live as a near normal life as possible. Because what happens is that after mastectomy or lumpectomy, the patients are given a padding to wear during the day, then at night they remove it. Or sometimes they are not even given anything. They have to stuff clothing and socks. So sometimes someone can look at you from the outside, they're like, what's wrong with you? But they don't know what the patient has gone through.
Sure.
The patient doesn't even have the energy to react to that. So if we offer reconstruction, which can be in form of either implants, or we can remove a part of the woman's tissue from the stomach and put it as part of the breast, then they can have as near normal life as possible.
Okay.
It's not the end. We can give you back, quote unquote, your dignity, because we've had social groups where women who've undergone mastectomy come support each other. They really want to have this reconstruction done so that they can get back their dignity. One day we should bring someone to give their experience, and you'll hear how important it is for them to gain that back.
Yeah.
Yes.
Okay. All right. So we are with Dr. Mukami and having a conversation on breast cancer, and in a short while we'll be getting to some of the other breast conditions that there are. I see a couple of questions already, Daktari, so we'll be getting to them, but in a few. Just before we get to that, just around the matter of breast cancer, I don't know if there's anything you feel we have left out that we can push a bit further or talk about before we get to these other breast conditions that there are.
Maybe to emphasize also that the men can be affected.
Okay.
Let's not leave them out.
Sure.
To them, I think it comes as a surprise.
Yeah.
They feel a lump, ignore it. Then later it becomes a wound. And the problem with the gentlemen is that they have very little glandular tissue. So if it's not acted upon hastily, by the time it eats the glandular tissue, it's also gone into the chest wall. And maybe it has metastasized quite quickly.
Okay.
So maybe just to mention that it affects the men.
What would you recommend for them? We the women are getting monthly checks.
Yeah.
What should they do? Should they do the same?
Yeah, they should, at least when you're taking a shower, just in passing too.
Yeah.
Just touch yourself, and if you feel the lump, please don't ignore it.
Yeah.
You know how men are.
And for the fear of
they
like
usually
I can
avoid.
take I can handle
They ignore.
it's nothing.
Even worse than the women.
Yeah.
So if you feel a lump as a gentleman, please seek medical attention as soon as possible.
Okay.
Yeah.
All right. Thank you, Dr. Ari. And we will be getting to discuss about other conditions that there are, breast conditions that there are. So I encourage you to send in that question on 20933. It's our SMS line at 0717400555 on WhatsApp, and we will be answering your questions in a few. Let's take a very quick break. We'll be back.
Experience the hope.